Here are a series of stretches and exercises that you can perform post-spine surgery. This isn't immediately days after your surgery. This is a few weeks in where you're able to walk, move around, but you're not yet at the point where you can do full rehabilitation and you're green lighted for movement in the spine. So we're going to spare the spine. We're not going to move it around. We'll do exercises and stretches for the ball and socket joints without excess movement in your low back. First, we're going to start with backward arm circles, 10 backward arm circles. So we're getting full rotation through the shoulders. You're keeping tight in the abs so that you're not hyperextending in the back while you do this. Abs stay tight. And just get 10 circles. Eight. And 10. Next, stretches for chest. Pec minor first, so palm up to the ceiling. You want this part of your hand in contact with either a wall or a post like this, 45-degree angle up to the ceiling, and turn away, hold for 20 seconds. You should feel that stretch right in through there. Next, repeat on the other side. This surface goes right into the post or a wall, up 45 degrees, and turn away, hold for 20 seconds. Next, we'll do stretch for pec major. Arm out at the level of your shoulder, palm into the surface, and turn away, hold for 20 seconds. Feel that stretch at the front of your chest. And repeat on the other side. Palm into the surface, arm straight out, turn away, feel that stretch at the front of your chest. Hold 20 seconds. Next, biceps stretch. Palm facing down, and you want this surface flat into the post or wall. Turn away. You should feel that stretch through the biceps into the shoulder. Hold for 20 seconds. Repeat on the other side. This surface flat into the wall or post. Arm straight out. Turn away and stretch for 20 seconds. After the stretches and mobilizing shoulders, next we'll get into push-ups off a countertop. Today I'm going to use the bar, for example, and show you the push-up. This is about the height of a high countertop. You want to make sure that this surface is steady, that you can't push it away from you, that the countertop is mounted firmly into whatever island or kitchen countertop you have. Place your hands just about shoulder width, a little bit further apart than shoulder width. And over here, we're not going to go really far back with this. We want to minimize any pressure into the spine. So doing a push-up out here, it risks too much of this dip in the hips. So get up fairly tall. You're almost standing in this position. And then just push towards and away from the countertop. So you can perform however many reps, give you some fatigue in the shoulders and the arms. The key things with this one are to get a nice full range and stretch through the chest. So when you're coming down into the surface, you get chest down to the surface, if you can manage that load, and then come back. Remember not to dip the hips forward like this. Don't put excess pressure with hyperextension through the spine. So keep your hips up, abs tight. All the movement happens just in your shoulders. If this is too difficult, a high countertop push-up, there is a variation, a regression for you, and those are wall push-ups. If the high countertop push-up is too difficult, wall push-up will be similar but easier. So you just step away from the wall very slightly just to get a minor angle, and then you'll push into the wall and away from it like this. So the range is more limited because the wall is in the way of you getting deeper, but it's still a way to perform a moving plank. So your hips don't move. You're not going like this into the wall. Keep your hips back, abs tight, and push in and away. Perform as many repetitions as give you some fatigue in the arms and shoulders. Don't overdo it. Don't get to the point where your form starts breaking down. Next, we have rows. Using a theraband or a thin band like this, we're going to secure this onto a post or something stable and row. So depending on the resistance you need, if it's too much out here, you might step forward to get a better resistance for you. If that's not enough, step further back to get that full squeeze and resistance in your mid back. A couple things not to do here. Don't hyperextend and move in your low back. We're trying to minimize movement in the low back. So stay tight in the abs and just focus on your shoulder blades doing the work. So for this, aim for 12 to 15 reps, where within those 12 to 15 reps, you feel fatigue in the mid back. Next, we have band pull aparts. So you're going to get the band taut at just past shoulder width. And from here, pull the band back like this, squeezing the shoulder blades together. So again, you want to avoid hyperextension in the spine, excess movement in the spine. Just focus on your shoulder blades doing the work, squeeze them together, and bring them back forward. And for that one, 10 repetitions. Next, we'll get into lower body exercises. We'll start with high knee march. Holding on to something stable like a post or countertop. Bring one knee up at a time and alternate. We'll go for 20 repetitions of this one in total. After you've done the high knee march, let's get some hip openers. So we'll do 4 of these where you're rotating your hip out to the side, and then switch 4 on the other side. Next, assisted squats. Holding on to a post, countertop, something stable. We're going to squat down to about quarter or half squat. Nothing more than that. We want to reduce the movement in the spine, and to do that, we're not going to attempt full range or challenge full range deep squats for now. Once you get the okay to perform full rehab for your spine, then you can challenge and get more depth out of the squat. But for now, just go for a quarter or half squat. We'll start with 10 reps of the squat. And lastly, we have calf raises. So I have a little ledge here that I can put my feet on, and that gives me a stretch in the calves, and then I can bring my body up and back down into the stretch. If you don't have a ledge like this, you can use a staircase, for example. Grab onto the handrail and then go off the edge of a step while holding on to the handrail and perform your calf raises. We'll start with 12 calf raises, and you can progress those over time. These exercises and stretches I just showed you are general exercises and stretches. They're nothing specific to spine health or rehabilitation from spine surgery. They are just stretches and exercises that you can start doing that will not interfere with the recovery process until you've been green lighted after the 6 to 8 week mark post-surgery to start performing full rehab for your low back. Everyone's different in terms of what their rehab protocol will be. Younger patients will get back into rehab much sooner than older patients will. So these are very individual circumstances. But if you are a couple weeks in, maybe you are older and you just had spine surgery, you need to be conservative in your approach so you don't aggravate and possibly create damage in the areas that were just incised and operated on. If you feel like any of these exercises are causing pain, irritation, injury, discontinue them. Always consult with a professional that can guide your individual case.